there any, you know anybody there that comes and sees us?
I do not.
No? Okay. I think that we have a few guys from out there. I'm not 100% sure though. So Firefighter, dealing with low back issue. You said upper where?
Like, I mean, a lot of times, of course, I'll have some soreness when else up top, but the majority of it's the lower back area.
Okay. How much gear are you wearing?
When we have a legit coffin, full stuff, you know, packed gear, so 60 pounds.
Yeah.
At least, you know.
Is that? Do you notice it more often after that?
A lot of times I do notice it doing that stuff on the calls and everything else, but. And then, like I said, now day-to-day stuff, sometimes I'm sleeping and I'll feel it, you know,
okay.
Wakes me up, toss and turn, and fall back to sleep now. And,
okay.
But yeah, just some of the day-to-day things when we're doing stuff around station sometimes, or wherever else, I'll feel it tighten up a little bit.
All right, so we want to try to get some movement. You've never been diagnosed with any type of disc issues, compression, nothing like that?
No, sir.
All right. No back pain here. And what level of pain do you normally experience at 0 to 10?
Generally, probably 6 or so, maybe even 7. Sometimes if I feel like I just stop doing what I'm doing for a second and you know, until it goes away and then continue on. But.
So what level would it be at today?
Oh, right now I'm fine. Like it's not like it's just constant. It's usually if I'm doing something that then I'll aggravate it or put on the gear for a while, you know, a certain amount of time.
So what we want to see is when we do therapy, how your episodes of low back pain are after therapy. So if you notice whenever you do feel it, is it less? Is it more? Usually what we want to see is, you know, less intensity, less frequency, right? So that's what we want to see with low back pain, especially at your age. We shouldn't be having a lot of issues down low, but it happens, right? At this age and at any, you know, there's no you know, certain age is going to determine, you know, the compression or issues with the low back. So we're going to get in here and do a little bit of examination and go from there. So we'll start really quick. If you want to stand right here facing the mirror. Put both of your hands on your pelvic bones or on your hip bones, right there, and I want you to look forward and look at your hand placement. Do you notice any unleveling of the pelvis?
No, sir.
Nope. Okay. Let's see here. Put it back up. Put your hands back up there. Okay. Good. I'm gonna notice that side a little higher. Let's have you touch your toes for me. Come back up. Any pain with that at all?
No, sir.
No. Okay. Let's have you lay right here on the table. Face up for me.
Face up.
Cool. All right. Right here, without bending your knees, lift both legs for me. Hold them right there and don't let me push down. Any pain with that at all?
No, sir.
No? Okay. I'm going to help you up here. Any pain with getting up like that? No? Okay. Let me have you lay face down for me. Okay. All right. So remember I was telling you that I'm noticing one hand was more elevated on the hips than the other?
Yes, sir.
Okay, right now when I'm just checking foot length, when I'm comparing foot side by side, I do notice that your right foot is slightly shorter. When I say slightly, about an inch or so. So it could be significant. And then of course we have better range of motion on one foot than the other, okay? Same thing right here, just kind of rechecking, and we are seeing that. So we're dealing with a little bit of muscle imbalancing is my thought here in the low back. Pain with that at all?
No.
A little bit? Right here?
Yeah.
And here?
No.
Here?
Yeah.
Here?
No.
No? Okay. Pain here? Here? Okay. All right. So right now I'm looking, just kind of assessing. We have a little bit of imbalancing in the pelvis. Okay. The muscle's a little tight. None of the exams that would come out positive with like a disc herniation or some major compression are coming out positive. So we might have a little bit of slight compression in the low back, L5S1 area, and this is a common reason why the episodes just kind of over and over happen, right? So we're gonna want to maintain spinal mobility, right? Get in here, use adjustments. We use electronic stimulation, hot packs, try to get you nice and loose, okay? So today we're gonna do a little bit of E-stem or stimulation, hot packs, get you nice and warm. Once that's done, we'll get in here and do the adjustments.
Okay.
All right, so we'll have you stay face down right there for me. And I'm gonna focus some electronic stimulation here on the low back area. All right, go right in here. How long have you seen our videos for?
I've seen them every now and then, probably. That's all. I look every now and then when you get put up on the YouTube.
Got you. So you follow the channels on YouTube?
Yeah, I keep my eye on Jason every now and then.
Nice. Okay. Here comes the low back stem here. Feel that?
Yes, sir.
All right. Now we want a nice deep compression. So you're gonna feel that right now, but we don't want it to get to pain. So if we can go a little deeper if you like. You tell me when to stop.
Okay. Okay.
Good? All right, I'm gonna use a couple of hot packs here. Get you nice and loose. All right. So you off today?
Yes, sir.
What are your, are you a full-time firefighter?
Yes, sir.
So what are your shifts?
I work 4 days a week,
Okay.
12-hour shifts.
Yep. Nighttime or daytime?
Daytime.
Cool. That's not too bad, huh?
No, it's not regular.
All right. All right, we're gonna let that run for about 12 minutes,
Okay.
and then we'll be back in here shortly and get you adjusted.